Greetings and welcome back to the Better Health Challenge. I'm Sean Episcopo from NoHusbandLeftBehind.com. In this session for week 5, we're going to explore the area of choices. And remember, my friend, this is a challenge for the rest of us. This is not for those who have been athletes their whole life. This is not for people that have been working out and they're ready to break a world record. This, we're saying, is a challenge for the rest of us. It's for those of us that are busy running to and fro, trying to get everything done at home, at work, and everywhere in between. And we just want to make sure that we do not neglect our physical health and well-being. We've got to make sure that we're taking time to focus on those areas which are critical. So you've noticed that we've covered a number of different things: nutrition, exercise, rest, detox, and now choices. So let's go ahead and start with the intro, shall we? I want to welcome you back. This is week 5. This is our 5th and final session for the series. Now, feel free to go back and review these in any order. If you've already covered them, you may want to go back, and there may be one or two that you want to just make sure that you didn't miss something very important. Honestly, in these challenges, my goal is not to give you a whole lot of information. I want to give you just enough to take action. And 99% of the time in my life, it's not that I need more information. It's usually that I need some encouragement, somebody to help me say, Sean, let's do this thing together. You know what I mean? You're not on your own in this challenge. So let's go ahead and get in the challenge. Let's find something for you to help you take that next step in the area that you, my friend, have been holding back on, and it's something that you've been wanting to do. So remember, you're in the driver's seat throughout this entire challenge, and honestly, in everything that we do. We want you to realize you're responsible for your decisions, and truthfully, I would have it no other way. I want to be responsible for the choices I make in my life, and I want you to feel totally empowered with the choices that you make. I'm here to help you as a guide. I really want you to take that next step that you've been holding back on, my friend. Whatever part of your physical health, you see something, you feel something, you know something deep down inside that you've been wanting to do, and you just haven't yet take the plunge. And truthfully, and we're not talking about anything drastic, this is just next step. Seeing something in your physical life, in your health, your well-being, something that you really feel that if you could just move a little bit further in one area, it would have significant improvement, especially over the next, month, 3 months, 6 months, and so on, right? So, like me, you should be considering a support network. There's people in your life that you've already been blessed by your creator, and your wonderful personality, I'm sure, has drawn in people throughout the years. So think about people like family and friends, neighbors, colleagues, and all other people that you can think of who really care about you, who want to see the best for you. There's likely people at church. There's probably people, if you volunteer in some type of community program, there's likely somebody that can be there for you. Maybe it's a best friend that, it's like, well, you could do this thing together even. So they could be a part of your support network and even an accountability partner. And of course, you have us here at NoHusbandLeftBehind.com. My wife and I would love for you to take the next step in the area that you've been holding back on that would definitely help you to, you know what I mean, to go to that next level in whatever part of your physical life it may be. Maybe it is just losing a few pounds. Maybe it's tightening up the waist. Maybe it's just eating a little bit less snacks and a little bit more, like lunch and dinner type of meals. Maybe it's just a little bit less sugar. Maybe it's whatever it is that you need at this point. And remember, your doctor and your pharmacist, and there's various people that have likely already told you something that you might want to consider, and it doesn't hurt to keep that fresh in your mind. So never forget, as I mentioned, the doctor and the pharmacist are two that, they usually have some different perspective than the rest of us. So your doctor is somebody you should talk to before you make any changes that could affect your health. And the reason why I think that, and we're supposed to say that anytime we talk about health, there's always supposed to be a disclaimer. But the truth is, in this challenge, we're taking baby steps, we're taking incremental steps. But nonetheless, you don't want to even take a small step in a direction that could hurt your physical health. Meaning that when I've asked you to maybe consider cutting back on sugar, there may be a reason why some people need a little bit more than others, just like salt and anything else. Some people need more protein, some people need more fiber. You've got to be very careful to make sure that you're getting what you need. I just want you to take that next step in the area that would help you. And then, as we mentioned, the pharmacist, if you're taking any medication, it might be wise to consider talking to someone before you start taking any herbal supplements or, any different things than what you're currently doing. So, expert advice I always encourage. And it never hurts to also talk to others that you will connect with along the journey. So, if we will, let's go ahead and assess where we are right now. So, where do you feel like you are, my friend? What areas of your physical health are you currently pleased with right now? The sessions we've already covered are nutrition, exercise, rest, and detox. And it could be that each one of these, you have certain areas you're doing really well in. I want you to kind of focus on at least one of these being an area where you're doing stronger in. For instance, it may not be what you're eating that's the problem. Maybe nutrition is not the problem. Maybe you're just sitting down too much. You need to get up and walk around. So maybe it's exercise. Maybe rest you're doing really well at. Maybe that is your stronger area, but maybe you need to work on detoxing, cleaning out the medicine cabinet or whatever it is. So let's look at the areas where you're stronger in, and then it never hurts to consider which areas you can do better in. And truthfully, I think for my own life, all four of these we mentioned, the last four sessions, I feel like I've got a nice grip on them. But truthfully, when I look at the details of what I could be doing to go to the next step, all four of these I could find next step material. So let's look at where you are right now, my friend, this week. What could you say no to this week that you've not already? Maybe it's a food or a beverage that's not really adding anything to your health, or maybe it's something that's not doing you any good or it's hurting you in some way. Maybe we've talked about, things like, sugary and salty and fatty, and there's so many different things. And what you need may be a little bit different than what I'm doing this week. But just consider what can you say no to this week that you feel deep down inside is really a breaker. Maybe it's that candy bar. I mean, this could be something that really take you to the next step. In the next week, you might even see results, right? Maybe it's that bag of potato chips. Maybe, you know what I mean? It's likely something you could say no to. You don't have to commit to it the rest of your life. Just look at this upcoming week. You have choices. I want you to see that you have options with your food and your beverage intake. Maybe it's distractions, things you see advertising, or maybe somebody said something that got you, questioning your decisions. And, truthfully, maybe it's impacting your exercise, your sleep, or something like that, it wouldn't hurt for you to just say no to that distraction, at least for the upcoming week. Maybe get to bed a little bit earlier, maybe take a walk a little bit more often on your lunch break, etc. So now on the flip side, what could you say yes to this week? So, we talked about walking more and eating a little bit better. Maybe it's cleaning out, the refrigerator, freezer, pantry, medicine cabinet, just looking for those outdated things or those things that you realize are no longer healthy, at least for the new and improved you. So we've looked at where you are now, right? So let's consider what the future could look like. What would you like the future to look like, my friend, in 30 days, in 60 days, in 90 days, and so on? So in the next, upcoming foreseeable months, right around the corner, what one thing will you be so happy at that point in time that you took time to change right here, right now, today? Is it giving up something? You know what I mean? Like we talked about the candy bar, the soda, maybe just doing one less, smoking one less cigarette, maybe it's one less whatever it is, one less beer, if you're having too much, it's amazing for every single one of us, my friend. There's no one path for every single human being, but there's likely one thing that you could choose to make different this week. What could you change that you feel deep down inside? Your doctor's been telling you, your best friend's been telling you, your colleagues have been telling you, the people who care about you probably been pointing something out. What is it, my friend, that you could change? Now, an example that I thought that this would be a good one for me, especially if I look out over the next 6 months, or even further. That let's say I'm excited to have lost 10 pounds, and for me that would be my winter weight, right? Winter living in the mountains, and then losing it all through the summer, running to and fro, even more than usual, and just from reducing my sugar intake. It's amazing how that we justify doing things in the hot blazing summer because we're sweating it out. That's just one example, but think about what you could do that you could change over this week and moving forward, that you can look back upon a few months from now and say, wow, I'm so glad that I just did that one thing. Now, who do you feel in your life is giving you a positive impact? Hopefully me as your guide. I want to get you to that next step. Accountability partners, family, friends, colleagues, neighbors, etc. Expert advisors, doctor, your primary physician, and various other people that you talk to that will help you understand what it is you should do and should not do. And then all other people that just offer you motivation, right? And as you progress through this, I want you to consider rewarding yourself for a job well done. We probably don't celebrate our accomplishments enough. So we don't want you to go back and splurge after you've accomplished your goal in, the next 30 days, but consider maybe you should take a day or two, take a weekend somewhere like the beach or the mountains, or maybe just go out for dinner to your favorite restaurant, or whatever would be meaningful to you. So we looked at where you are, where you want to go. Let's consider the journey, my friend. There's probably a little bit of a gap over the next 30 days and beyond. So I want you to consider creating one priority or area of focus over the next month or so. What's most important to you, my friend? Don't try to do multiple things in the next 30 days. If you can help it, try to focus on one thing. What's most important, and which one of these 4 lessons that we've already gone through was most profound? Because that's probably where you want to focus. And then go ahead and obtain a commitment from one person, if you will, to be your accountability partner. If you want one at home, one at work, consider your best friend, unless they're aiding in the problem. And then consider other people, maybe a colleague at work, somebody who really cares about you and wants the best for you. Now, lastly, if you will, I want you to consider getting some expert advice this week, next week, as you're looking at what you want to do for the next, 30 days or so. Go ahead and commit to talking to your doctor. If you're going to make any possible changes that could impact your health, your pastor, if you're looking for that encouragement, for somebody you look up to, it could even be, somebody else. Maybe it's like a father figure, a motherly figure, somebody that really gives you that positive, says something, it really kind of helps get inside of you and helps, you take that next step. Family, friends, and everyone else, my friend, that'll be a part of supporting you in the journey that you've chosen for yourself over the next 30 days. And I want to encourage you, my friend, that if you have enjoyed this quick training video, and I hope you have enjoyed this series, consider subscribing to our YouTube channel, and then be on the lookout for other videos, other challenges and things which are coming. This is video 5 of 5 in the Better Health Challenge. But remember, we have other ones already posted, and God willing, there will be some yet to come. And then the last thing is, for additional resources and or to connect within our community, consider visiting our website, nohusbandleftbehind.com. Thanks for being a part of this challenge, my friend. I wish you the very best over this upcoming week, and God bless.